Today we will start with next topic, that is pharmacokinetics parameter, absorption, distribution, metabolism and excretion, which is continued to the general pharmacology. Absorption is the process of the movement of drug from the site of administration to the systemic circulation. Absorption is nothing but the process when you take any kinds of the drugs or the tablet, it reaches into your GIT. From the GIT, that drug reaches into your blood. That process is known as the absorption. The absorption is classified into the three types, that is transcellular, paracellular and endocytosis. By these three ways your absorption will takes place. Transcellular, which is known as intracellular, it is further divided into passive diffusion, active transports and facilitated transports. Paracellular or intercellular, which is further classified into co-transport or filtrations. Endocytosis, that is pinocytosis or phagocytosis. First, we will start with the transcellular. In this diagram, you can see the drugs will move across the cell membrane, not from the cell membrane. It will cross across the cell membrane, and it is known as the intracellular or the transcellular. Intra means across the cell membrane. Almost all types of the drugs are absorbed through these mechanisms only. Okay, first we will start with the passive diffusion. It is the movement of the drugs or the molecules of the drugs from higher concentration to the lower concentration. For example, when you take the tablets or the drugs, it will reach us into the GIT. From GIT to the blood, it will move from higher concentration to the lower concentration. Where the concentrations of your solutions or your solutes will high, it will move from that part to your the blood part. That is known as the passive diffusion. As we know, from higher to the lower concentration, there is no required of the energy, because it is not going against the gravity or against the gravitational or concentration gradient. So there is no required of the energy. Almost 90% of the drugs are absorbed by these mechanisms. So in this, lipid soluble drugs will transfer across the cell membranes, which are very much soluble in the lipids, that will across by this passive diffusion or by this intracellular mechanisms like morphine. As we know, your cell membrane is made up of the lipids, that is phospholipids. So your drugs which are soluble in lipid will easily cross the cell membrane and enters into your systemic circulations. Next is active transport. It is opposite to your passive diffusions. In this, transport will take place from lower concentration to the higher concentration. So it will require the energy in the form of the ATPs, because we are going against the gravity. Now we know as when we are going from top to the bottom, we does not require any kinds of the energy. But when we are going from bottom to the top, we require any kinds of the energy. So because we are going against the gravity, so we required more energy to climb that hills. In same case, we required the drugs to move from lower concentration to the higher concentration. We required one special carrier to move that drugs, and that it is in the form of the ATPs. Carrier means nothing but mediators that will move the drug from your GIT to the blood. For example, steroids, hormones are well absorbed by this transports. Okay. Now in this diagram you can see from the GIT to the blood there is a membrane. You have to cross that membranes to reach into that blood. From this GIT to the blood, your drugs move. It is known as the absorption. When this GIT, we require your drugs bind to this carrier. Okay, this carrier and drug will forms a complex, and then it will crosses the cell membrane. So in this way, your active transport will takes place. Next is facilitated transport. Facilitated transport, it is also known as a carrier mediated transport. It does not depend upon the concentration gradient because it does not require the energy or the ATPs. For example, vitamin B12s are always absorbed by the facilitated transport. As we know, vitamin B12 requires the intrinsic factors for the absorption. So, in this diagram, you can see the vitamin B12 and intrinsic factors forms a complex with the help of this carrier. So, this carrier will take this complex, that is vitamin B12 and intrinsic factor complex, to the other side, that is blood, and then it crosses the cell membrane. So it requires a carrier. So it is known as the carrier mediated transport. Next is paracellular or intercellular. Intercellular means between the two junctions of the cells, or not across the cell, between the cells. It is known as the intercellular. In that, pore transport or filtration kills. Filtration, it is the process in which water soluble drugs will move. Means in the first case we have seen the lipid soluble drugs, now we are seeing the water soluble drugs. As I told previously, your cell membrane is made up of the lipid soluble, that is phospholipids. So lipid soluble drugs will easily move, but the water soluble drugs will not easily move. So we require a pore for that. In that, capillaries or that pore will opens, your molecule will bind, and then it will be crosses. But the condition is that it will requires the less molecular weight than the 100 Dalton. So it can easily crosses through the cell membrane. That pores will present in the cell membrane, and then it will crosses or reaches into the systemic circulations. For example, absorption of the urea. The absorption of urea takes place by this filtration or the pore transport method. Pore transport is means that will be a pore will be there in that membrane, and that drugs will bind to that pores or enters into that pores, and then it crosses the cell membrane. Endocytosis, it is also known as a vesicular transport because the cell membrane engulfs or eat that extracellular material by forming a vesicles. In the diagram, you can easily see that the GIT membrane and blood is there. In the GIT, if you take your drugs, in a membrane you have a vesicles. Vesicles means nothing but we will consider as a bowl. Your drug will enters into that, and your in the blood your drugs only remain. Other things will engulf by your membrane. That is known as the endocytosis process. It will takes by the two types, pinocytosis and phagocytosis. Phagocytosis means engulf of the solid particles. Pinocytosis means engulf of the liquid particles. This is all about the absorptions. Now next is the factor affecting the absorption. As we know, when the absorption will take place, you have to consider the different parameters for it, in which physical properties came, dosage forms will come, and physiological factors will come. First we will start with the physical states. As we know, liquids are better absorbed than the solids. Amorphous forms are better absorbed than the crystalline forms. As the state varies, absorption will vary. That is true because when you take the liquid, it will better absorb. The solid will require the more time for the absorption. Amorphous forms will better absorb than the crystalline form. Next is lipid and water solubilities. Lipid drugs will have the higher rate of absorption through the GIT than the water. Yes, as we know that your cell membrane is lipid, so your lipid soluble drugs will reaches from GIT to the bloodstream easily with the high rate of the absorptions as compared to your water soluble. So fat soluble vitamin, that is your vitamin A, D, E, K, are better absorbed from your stomachs. Okay. Next is the dosage forms. So first is particle size. As we know, the smaller particle size will have the greater absorption because as much your particle size is smaller, it having the larger surface area, and the surface area will larger, it will get easily absorbed. If you take the larger particles, it does not disintegrate rapidly. Now, the thing is that when you take your particles, when you take your drugs, it will enters into your GIT. at there it will get disintegrate. Disintegrate means it will get converted into very small particles, and then it get dissolved in your blood, sorry, in your, it will get dissolved in your GIT lumens, where it will mixes with your salivas and various fluids or enzymes which are present in your GIT. So, if larger particles will there, it will require more time to disintegrate, to break down. So, it will take more time for the mixing, and then it will go for further blood vessels. It will take the more time. So, the particle size will smaller. It will get easily disintegrate or break down into the smaller particles, and it will dissolve fastly and get absorbed rapidly. So, smaller particles are preferred for the good absorptions. Formulations: substances like lactose, sucrose, calcium phosphate are used as inner dilutes in the formulation of the tablet. And these reactions will active with the drugs and affect the absorptions. As we know there, the absorption, when you make any kinds of the formulations, if you are making any kinds of tablets, you require various excipients like your lactose, starch, sucrose, which will affect the absorption also, because when you take the calcium ions, it will reduce the absorption of tetracyclines types of the drugs. Tetracyclines are the antimicrobials or the antibacterial drugs. Tetracyclines, when you take the tetracyclines drug, and if you are using the calcium ions in that, or you are externally taking the calcium ions, it will reduce the tetracycline absorption, because your calcium ions will form a chelatin or complex with the tetracycline. So because of this, it will not get easily absorbed, and for that chelatins or that chelates of the tetracycline will reduce the absorption rate. Next is physiological factors. In that, first is pH. As we know, the pH will affect the absorption, because acidic drugs are well absorbed from the stomach. That is, aspirin will absorb from the stomach, because acidic drugs, that is your aspirin, is the acidic in nature, and it will get absorbed from the acidic media only. Basic drugs like your ephedrine will absorb from the alkaline medium, that is from your intestines. If you are taking aspirin and you are taking the basic medium, that it will not absorb. So proper acidic drugs will absorb from your acidic mediums only. So pH will plays an important role for that. Now next is the ionization. As we know, unionized drugs are lipid solubles, while ionized drugs are water solubles. So as we know, those drugs which are lipid soluble will fastly process the cell membrane and get faster absorbed. So unionized drugs are better absorbed than the ionized drugs. Now the area of absorption. As we know, the area will matter far. The drugs will better absorb in the intestine, because it having the larger area. Okay, because of the larger area, the drugs in the intestine will faster absorb than the stomach, because large intestine is having a larger area as compared to your stomach. So it will, the drugs which are in the basic mediums or alkaline mediums will faster absorb. Next is the gastrointestinal transition times. Absorption of the drug is decreased by the presence of the food. Rapid absorption occurs in the drugs which are administered before the food. As we know, gastrointestinal transit times will delay the absorption. For example, when you take the drug in the presence of your food, it will degrade with that food, and it forms a drug food interactions. So the time of the absorption will get decreased. So these are the various factors which affect the drug absorptions.